So what are the early signs or warning signs of any cancer? Okay, so these are important, and we should know about these signs, as these signs could mean that the symptom represents inside the disease is going on. Having these symptoms or warning signs does not always mean that these are due to cancer. Okay, this is important to know, that these signs could come from many things, but still we should be suspicious about these signs when we notice them. For example, if we start from head, the brain. If there is a tumor inside brain, it would first lead to a repetitive or constant headache. But as we all know, cancer is not the commonest cause of headache. It could be due to, most likely it would be due to any other thing. But if we are seeing that it is happening consistently again and again, if it is associated with other symptoms like vomiting, like weakness in any of your limbs, or any fits are happening, or your vision is getting disturbed, then you should correlate and you should definitely consult a physician or a doctor. So always it is a combination of multiple things that we should look around that could be pointing towards a tumor or a cancer, and it's always good to consult a doctor and talk about that possibility. See, we should understand that all of us are at risk. So anything could be possible. It's always prudent to rule out things. If we come down to oral cavity, if there is an ulcer which is painless, first thing, which is not healing over a 2 to 3 week period, if it is white color or red colored, associated with your habit of chewing tobacco, then also you should consult an ENT surgeon and ensure to check if it is due to cancer. So oral cavity cancers are commonly happening in this form. It could be over your tongue, it could be inside of your cheeks, it could be over the gums. Coming further down, in your throat, if you are finding it difficult to swallow things, don't wait for too long, immediately consult a doctor. If you are finding pain while swallowing, it could be, as I said, it is not always due to cancer, but it is always good to consult a doctor and get yourself checked. If there is a change in voice, we call it hoarseness of voice. If it is increasing, that could be a marker of cancer of the larynx or the voice box, because it might be pressing over a nerve that is affecting the functioning of your voice box, and that is why quality of voice is changing. That could be a warning sign or an early sign of cancer. If we come down in the chest, among women, if there is discharge from nipples, it could be dirty, white, watery discharge, it could be bloody discharge, it could be pointing towards possibility of having cancer. Not always, but always good to check. If you check yourself by the flat of your hand, the fingers, and standing in front of mirror, you would find any abnormality in both the breast or any difference in size or shape or overlying skin of both breasts, it could be pointing towards cancer. If you press by the flat of your hand and if you feel some lump or some swelling inside, it could be. It is not always cancer, it could be cancer. But it's always good to check with your doctor. Similarly, in the chest, if you are having cough which is lasting more than 3 weeks, in spite of medications, the cough is not going. Or if you find blood in the cough, sputum that comes out, if you find any streaks of blood, these could be pointing towards cancer. If you find pain along with cough, especially that happens in the back, the side of the back, that could be pointing towards cancer of the lung. Not always, but it's always good to get yourself checked. Coming down in the abdomen, there are a lot of organs inside our abdomen, the stomach. It could be our gastrointestinal tract where the digestion happens. It could be liver, pancreas, kidney, spleen. If you come down further, there are female genital organs. So a lot of organs are inside and there is a lot of space. So it's important that we catch or look for those early signs and immediately consult a doctor. Suppose for GI cancers, the stomach cancer could be leading to occurrence of pain in the upper part of the body, or indigestion, or difficulty in swallowing food. That could be blocking the flow of food inside. Okay? And any ulcer is there inside that could turn into malignant. So always good to discuss with your treating doctor. Any blood or any change in habits, daily habits of bowel. If you find too much difficulty in passing the stools, or if there is blood in stools, or if there is multiple episodes of pain and other difficulties in passing stools, it could be due to cancer in any of the intestines, the large intestine for most common, okay, or the rectum. These could be warning signs for cancer in the gastrointestinal tract. Similarly, liver cancer, it could lead to multiple things. Weight loss, unexplained weight loss, more than 10% of body weight if you are losing over a period of say 1 month or 2 months, which has never happened before, or you have not deliberately reduced your weight, still falling without any other symptom, it could be a warning signal, an alarm for you to immediately consult your doctor that you have lost more than 10% of your body weight. Though you did not intend to lose it, you never sick about, you didn't have the disease, but still you lost weight. It could be happening due to cancer. If your blood stools are consistently dark or reddish, you are losing blood somewhere. It could be due to cancer. Liver, if you're feeling pain in the right side of the stomach or abdomen, or if you're having jaundice, or if you're feeling weakness, all these correlated may be pointing towards cancer. If there is any swelling in the body, other parts of the body, if you see hands, arms, back, the side arms, the underarms, these all could be swellings you could find which are abnormal. One side of the body it is there, one side it is not there. And most of the times it is important to remember that such a swelling, if it is cancer, it would be painless to start with. Cancer becomes painful when it increases in size, it becomes too big for other parts of the body to be present there. So it pressurizes the nerves and other parts, and that's how it causes pain. But if you are feeling a painless lump or a swelling in your arm, hand or something, better to discuss with your doctor. Especially if it is growing fast. Long-standing lumps or swellings which are painless could be lipoma also. So don't worry about those. Your doctor would tell you that it is mostly due to a lipoma, which is long-standing over years. It is not growing in size, it is not moving around, no other problem. That is not to be worried about. If it is growing over a 1 or 2 month period, if you find that it is growing and it is painless, then definitely it's always prudent to consult your doctor. So all these signs could be due to cancer. There could be a skin ulcer that is painless to start with. It could be bleeding, it might not be bleeding. But if it is ulcer is there, it is not going away within 2 weeks, in spite of using antibiotics, applying ointments, taking antibiotics, treatments, everything, it could be due to cancer of the skin. So in such a manner, if you are vigilant and if you are trying to identify symptoms which could be a warning sign, and if you are able to correlate, or if you are thinking that these all features could be there, it's always good to consult a physician and discuss about the possibility of cancer. Remember that all of us are at risk of developing cancer. I am at risk of developing cancer. Anyone else, all doctors, everyone, even athletes, everyone can develop cancer. So never ignore any warning sign. Make it a point to consult your physician if you have. There's no need to worry about it. I'm not saying you should get worried, but it's always good to be vigilant. Remember that cancer has 80 to 90% probability of getting cured if you are catching it in the early stage of disease. So if you are vigilant, if you are alert enough to catch any warning sign and discuss. Whenever you have these warning signs, when you go to the doctor, likely it won't be cancer. When you go to them, they would tell you it does not look like that. When they examine, when they test it, it could turn out to be non-cancerous. But there is a possibility for some cases, it could be cancer. So always check, get yourself checked, be alert. If it is ruled out by the doctor, very good. At least you are out of that tension. But always good to check yourself with the physician if you have any of these warning signs as we talked about. Thank you.